I think all staff should be, frontline staff are entitled to it free. The trust, pay for our own vaccines. It's there to make sure, where possible, that staff do not go off sick with flu. Flu's not good. It's not an easy cop out. It's not a case of I can get a couple of days. I'm tired. You are physically exhausted to a point that you have no energy to get out of bed. You have headaches, you get general malaise, you are physically and mentally exhausted. It's minimal disruption for the teams, yes, it's true, but also it's maintaining that service so we don't expose our patients to any additional risks. It's maintaining good, healthy environments. For staff generally, we provide additional equipment to minimise the risk of transmission for infections generally, and that's making sure they've got good hand hygiene equipment. And yes, that includes the use of hand sanitisers, the hand frame. They are essential. It is essential that we do not transmit the virus to patients who may well be immunocompromised, who are frail, who are already at risk because their immune system's fighting something else. So to actually give them something on top of that, I believe it's not fair at all. It's quite unsafe. I used to do that myself, I'll admit, many years ago when I was like a student nurse. But actually, it's developed, it's a dead vaccine, it's not a live vaccine. It takes your body usually about 2 to 3 weeks to develop full immunity to that particular strain. So, if somebody says to us, actually I've got the flu 2 days after that, it's because they socially acquired that elsewhere, not because of the vaccine. The vaccine cannot give you flu. Staff can actually get their flu vaccination from a number of settings. We promote it heavily within Cambridgeshire Community Services because it is a good idea. Where staff are unable to get onto a clinic via our occupational health service or from our own immunisation team, we can go out to the individual. And what we have is a direct telephone line, a seasonal flu hotline, and also a seasonal flu email address. So it's operational 24 hours, 7 days a week. Although we don't vaccinate over the weekend, we do provide a service to suit the individual or within the team. And we do go out to team meetings, for example, where we can vaccinate the majority, if not all, of the members at that meeting.